Most people think lowering blood pressure means long walks, bland food, and a handful of pills every morning. I've been a cardiac surgeon for over 20 years. I've opened chests, I've held human hearts in my hands, and I'm telling you, that picture is outdated. There are 3 things you can do in 10 minutes that your cardiologist probably never mentioned. They're backed by clinical research. They cost nothing. And after 60, they work better than most standard treatments. Stay with me because what I'm about to show you changes everything. By the time you're reading a number on that cuff, 140, 150, 160, the damage has already been happening for years, quietly, without a single symptom. High blood pressure doesn't hurt. It doesn't announce itself. It just works in the background, putting pressure on your artery walls every single minute of every single day. And over time, that wears things down. The heart, the kidneys, the brain. That's why we call it the silent killer. And it's not just a catchy phrase, it's literally what happens. Now, here's the part that frustrates me as a surgeon. We've been treating this problem backwards. A patient comes in with high blood pressure. What happens? They get a prescription, maybe 2, and they're sent home with the message, take these, watch your salt, try to walk more. That's it. No one sits down and explains what's actually happening inside their arteries. No one shows them what they can do about it in 10 minutes a day. And the pills, they help. I'm not against medication. Please hear me on that. But pills manage the number. They don't fix the underlying problem. They don't restore flexibility to stiffen arteries. They don't train your nervous system to calm itself down. That requires something different. Here's what changes after 60 that makes this so important. Your arteries naturally lose elasticity as you age. Think of them like a garden hose. A new hose is flexible. It bends, it stretches, it handles pressure easily. An old hose gets rigid, brittle. The same amount of water creates far more pressure inside it. That's exactly what happens to your blood vessels over decades. And standard advice, walk 30 minutes, eat less salt. It's not wrong, but it's not enough. Not after 60. Your body needs something more targeted, more precise. That's what the next 10 minutes are about. Let me explain what's actually happening inside your body. Because once you understand it, everything else makes sense. Your artery walls are made of smooth muscle and elastic tissue. When you're young, that tissue is supple. It expands when your heart pumps blood, then snaps back like a rubber band. But after decades of use, and especially after 60, that elasticity starts to go. The walls thicken, they stiffen, and a stiffer artery means higher pressure. Full stop. Now, here's what most people don't know. Regular cardio, walking, cycling, even swimming is great for your heart, but it doesn't directly target arterial stiffness. It gets your heart pumping faster, yes, but it doesn't specifically force those artery walls to relax and expand the way we need them to. So what does? That's where most cardiologists stop short. And that's exactly where this protocol begins. Have you ever wondered why 2 people the same age can have completely different blood pressure readings, same diet, same weight, same lifestyle? The answer is almost always in the arteries, their flexibility, their responsiveness. And the good news is that's something you can actually train. Here's the thing about isometric exercises. They look like nothing. You're not running, you're not jumping, you're barely moving. A wall sit, a plank holding still while your muscles work hard underneath. And yet, the research on these is remarkable. A 2023 analysis published in the British Journal of Sports Medicine looked at different types of exercise and their effect on blood pressure. Isometric exercises came out on top, above cardio, above weight training, above everything else. For people over 60 with elevated blood pressure, regular isometric training reduced systolic pressure by an average of 10 points. 10 points. That's the equivalent of adding a second blood pressure medication for many patients. How does it work? Here's the mechanism. When you hold the walls sit or a plank, your muscles contract hard and stay contracted. That temporarily restricts blood flow. And then when you release, your blood vessels suddenly flood with blood. They expand rapidly. And over time, that repeated expand and release cycle actually retrains your artery walls to be more flexible, more responsive. It's like physiotherapy for your vascular system. So, here's a protocol. 6 minutes total. You can split it however works for you. 2 minutes of wall sit, Slide your back down a wall until your thighs are parallel to the floor. Hold, breathe normally. Don't hold your breath. Then 2 minutes of plank. Forearms on the floor, body straight, core engaged. Then finish with 2 more minutes of wall sit. That's it, 6 minutes. No equipment, no gym. You can do this in your living room in your pajamas. Now, and this is important, if you're new to this, start with 30 seconds each and build up slowly. Listen to your body. If you feel chest pain or dizziness, stop immediately and speak to your doctor. But for most people over 60, this is completely safe and extraordinarily effective. And if you want the full written protocol, exact timing, rest periods, a daily tracking sheet, I've put it all together in one place. The blood pressure guide is linked in the description and in my profile. I understand it's hard to remember everything from a video. This guy puts it all in your hands. All right, 6 minutes of isometrics done. Now we move to something that looks even simpler and works even deeper. 2 minutes of control breathing. Dr. Odawali breathing, really bear with me because this isn't yoga class breathing. This is targeted neuroscience. And when you understand what's happening, you'll never skip this part. Your body has 2 modes, fight or flight. That's your sympathetic nervous system. Accelerator pedal, heart rate up, blood pressure up, vessels constrict, and rest and digest. That's your parasympathetic nervous system. Brake pedal, heart rate down, blood pressure down, vessels relax. Most people over 60 with high blood pressure are stuck with their foot on the accelerator. Even at rest, even while sitting quietly watching television, their nervous system never fully switches off. And that constant low-level activation keeps blood pressure elevated around the clock. The vagus nerve is the direct line to that brake pedal. It runs from your brain all the way down through your chest and into your abdomen. And here's the remarkable thing. You can stimulate it deliberately with your breath. Here's how. Inhale through your nose for 5 seconds. Exhale through your mouth for 5 seconds. That's 1 cycle. 6 cycles per minute. Do that for 2 minutes straight while sitting quietly with your eyes closed. This specific rhythm, 6 breaths per minute, is called resonance breathing. And it's not arbitrary. At exactly this frequency, your heart rate and your blood pressure oscillate in perfect synchrony with your breath. Your vagus nerve fires, your parasympathetic system activates, your vessels dilate, your heart slows. Studies have shown that just 8 weeks of daily resonance breathing can reduce systolic blood pressure by 8 to 10 points, comparable to medication done in 2 minutes, sitting in a chair, and the effect stack on top of the isometrics you just finished. Your arteries are already more relaxed from the wall sits and planks. Now, your nervous system catches up. The two work together. That's the whole point of sequencing them this way. One question I get all the time. Can I do this lying down? Yes, but sitting upright works better. It keeps your diaphragm free and your vagus nerve engagement stronger. Try it in a chair, feet flat on the floor, hands resting on your thighs, eyes closed, 5 seconds in, 5 seconds out, 2 minutes. That's all. Now we're in the final 2 minutes of the protocol, and this is the part that surprises people the most. You're going to drink water, but not the way you normally drink it. Here's something most people don't connect. Dehydration and high blood pressure are directly linked. When your body doesn't have enough fluid, your blood becomes more concentrated, thicker. Your blood vessels compensate by narrowing to maintain circulation. And narrower vessels mean higher pressure every time. Now, after 60, this problem gets worse. Your thirst mechanism becomes less reliable. You can be significantly dehydrated and not feel thirsty at all. Which means millions of older adults are walking around chronically underhydrated and wondering why their numbers won't budge. But here's where it gets interesting. It's not just about how much you drink, it's about how you drink it. Gulping water quickly activates your sympathetic nervous system, the accelerator. It's a mild stress response. Your body interprets rapid fluid intake as something to manage urgently. But slow, deliberate sipping does the opposite. Small sips spaced out, taken calmly. This activates your parasympathetic nervous system, the same brake pedal we just hit with the breathing. So in these final 2 minutes, pour yourself about 450 to 500 milliliters of water. That's roughly 16 ounces, just under 2 standard glasses, and sip it slowly. Deliberately. 1 small sip every 10 to 15 seconds. No rushing. What you're doing is locking in the calming effect from the breathing exercise. Your nervous system is already in parasympathetic mode. The slow sipping keeps it there. It extends the window and it rehydrates your blood, reducing that viscosity that was constricting your vessels. Think of it as the cool down, the seal on everything you just did. If this is making sense to you, hit subscribe. I post every week. Always evidence-based, always practical, no fluff, just the information your body actually needs. Here's the truth about health habits. The protocol doesn't matter if you don't do it consistently. And consistency doesn't come from willpower. It comes from design. The single most effective strategy for making this routine stick is called habit stacking. You attach a new behavior to something you already do automatically every single day without thinking. So here's what I recommend. Pick one anchor, something you do every morning without fail. Brushing your teeth, making coffee, sitting down for breakfast. The moment that thing is done, you go straight into your 10 minutes. No decision required, no motivation needed. The anchor triggers the protocol automatically. This works because your brain doesn't treat it as a new habit. It treats it as an extension of something familiar. And that dramatically reduces the friction that kills most good intentions by day 4. The second thing, track it visually. Get a simple paper calendar. Hang it somewhere you'll see it every morning. After each completed session, draw an X. After 7 days, you have a chain. And the psychology here is powerful. You genuinely don't want to break the chain. It becomes its own motivation. And one more thing, if 10 minutes feels like too much at the start, begin with 5. 2 minutes of wall sit, 2 minutes of breathing, 1 minute of slow sipping. A reduced version still delivers real benefit, and starting small beats, not starting at all every time. I want to be straight with you here because there's a lot of noise online about natural approaches to blood pressure. So let me tell you exactly what the evidence shows and what it doesn't. Isometric exercise and blood pressure. This is one of the most robust findings in recent cardiovascular research. That 2023 British Journal of Sports Medicine meta-analysis covered over 200 studies. The conclusion was clear. Isometric training produces the largest reductions in both systolic and diastolic blood pressure of any exercise type, particularly in older adults. That's not a small study. That's the best available evidence we have right now. Resonance breathing. The research here is strong and growing. Multiple randomized control trials have shown meaningful reductions in blood pressure with consistent practice. The vagus nerve connection is well established in neuroscience. This is not alternative medicine. This is physiology, hydration, and blood pressure. The link is documented and consistent across studies. Chronic mild dehydration raises blood pressure. Adequate hydration reduces it. The slow sipping protocol, specifically the parasympathetic activation piece, is supported by research into vagal tone. Solid science. What does the research not show? That any of this replaces medication in people with severely elevated blood pressure. If your numbers are dangerously high, above 160 systolic, this protocol is a complement to treatment, not a substitute. Please work with your doctor. That part is non-negotiable. But for the majority of people over 60 with mildly to moderately elevated pressure, this is exactly the kind of targeted lifestyle approach that can genuinely move the needle and in some cases move it dramatically. I've seen people try this protocol, give it 3 weeks, and then tell me it didn't work. And almost every time when I asked them to walk me through what they were doing, I find the same mistakes. Let me save you the frustration. Mistake number 1. Holding your breath during isometrics. This is the most common one, and it completely undermines the whole point. When you hold your breath during a wall sit or plank, your blood pressure shoots up temporarily instead of down. Breathe normally throughout, in and out, steady and relaxed. If you can't breathe normally, you're working too hard. Reduce the intensity. Mistake number 2, rushing the breathing exercise. 5 seconds in, 5 seconds out. I've watched people do 3 seconds in, 2 seconds out, fidget, open their eyes, check their phone. That's not resonance breathing. That's just sitting. The specific 6 breaths per minute rhythm is what activates the vagal response. If you rush it, you lose the mechanism entirely. Set a timer. Commit to the 2 minutes fully. Eyes closed, phone face down. Mistake number 3, gulping the water. I know it sounds minor, but if you finish a breathing exercise in a calm parasympathetic state and then throw back a full glass of water in 10 seconds, you've partially canceled the effect. Small sips, slow pace. The water is the cool down, not the finish line. Mistake number 4, doing too much too soon. This one is particularly important for people over 60. Enthusiasm is wonderful, but jumping straight to 2-minute wall sits when your legs aren't used to it leads to soreness, discouragement, and quitting. Start where you are. 30 seconds is a legitimate starting point. Build by 15 seconds each week. Your body will adapt. Give it time. Mistake number 5, skipping days and calling it failure. You will miss a day. Life happens. The protocol breaks down for a week because you travel or you're unwell. That is not failure. That is normal. The only failure is deciding that a missed week means the whole thing is over. It doesn't. You pick it back up the next morning. The chain starts again. Your arteries don't forget the progress you've already made. Here's what I want you to really sit with for a moment. You just learned a 10-minute protocol that targets 3 separate mechanisms of high blood pressure simultaneously. Arterial stiffness, nervous system dysregulation, chronic dehydration, 3 root causes, 10 minutes every single morning. And here's what shocks most of my patients when I explain this. Pharmaceutical companies spend billions of dollars developing drugs that target one of those mechanisms. 1, a calcium channel blocker works on vessel tension. An ACE inhibitor works on fluid regulation. A beta blocker works on heart rate. Each one is a single tool aimed at a single target, and yet we hand people a prescription and call it a complete solution. This protocol hits all 3 at once naturally with 0 side effects, 0 cost, and it compounds over time, meaning the longer you do it, the stronger the effect becomes. Your arteries get more flexible week by week. Your vagal tone improves month by month. Your hydration baseline stabilizes. The numbers on that cuff don't just drop, they stay down. I've been a cardiac surgeon for over 20 years. I've seen what happens when blood pressure goes unmanaged for decades. The strokes, the heart failures, the kidneys shutting down. I've held the consequences of neglect in my hands in the operating theater, and I can tell you with absolute certainty, the 10 minutes you spend on this every morning are worth more than you can possibly imagine right now. This is not about avoiding medication. This is about giving your body every possible advantage. This is about being proactive instead of reactive. This is about showing up for yourself at 60, at 70, at 80, with the same intention and discipline that built everything else in your life. Your arteries are not done. Your nervous system is not done. Your body still responds. It still adapts. It still heals, but only if you give it the right signals. Starting tomorrow morning, 10 minutes. That's the investment. The return is years. So let's bring it all together. 10 minutes, 3 steps every morning. Minutes 0 to 6, isometric exercises. Wall sit and plank. Hold, breathe, release. You're retraining your artery walls to be flexible and responsive again. 6 minutes total. Start with 30 seconds if you need to build from there. Minutes 6 to 8, resonance breathing. 5 seconds in through your nose, 5 seconds out through your mouth. Eyes closed, sitting quietly. 2 minutes. You're activating your vagus nerve and switching your nervous system from accelerator to brake. Minutes 8 to 10, slow sipping. $450 to $500 milliliter of water. Small sips, deliberate pace. You're rehydrating your blood, reducing vessel constriction, and locking in the calm your breathing just created. Stack it onto something you already do every morning. Track it on a calendar. Start smaller than you think you need to and give it 6 weeks before you judge your results. Which of these 3 steps surprises you the most? The isometrics, the breathing, or the way you drink water? Let me know in the comments. I read every single one. And if someone in your life is dealing with high blood pressure, share this video with them. It might be the most useful 10 minutes they spend this week. I don't run ads, I don't push supplements, I don't take brand deals. What keeps this channel going is people like you. If you believe that evidence-based medicine should be accessible to everyone, subscribe and consider becoming a sponsor. Take care of yourself, be consistent, and remember, everything you do with your body is a conversation. Start talking to it differently starting tomorrow morning. And before making any changes to your health routine, especially if you're on medication, please speak with your own doctor first. That's not a disclaimer. That's just good medicine. Please subscribe my channel for valuable content.